Assalamu alaikum. I hope so you guys are doing well. So today the topic that I am going to discuss with you is about the facial nerve lesions. It is a very high yield topic, and every student should know about the difference between upper motor neuron lesion of the facial nerve and the lower motor neuron lesion of the facial nerve. So before discussing the difference, let's discuss about Bell's palsy. It is actually the most common cause of peripheral facial palsy, which is actually due to herpes simplex virus reactivation, and it can also be caused by Lyme disease, herpes zoster, Ramsay Hunt syndrome, sarcoidosis, tumors, for example parotid gland, and diabetes mellitus. And the treatment that can be given is glucocorticoids or acyclovir, which is an antiviral as well. Then there's a difference between upper motor neuron lesion and lower motor neuron lesion. So now how you are going to tell the difference between it. So if you are going to tell the patient to frown, and if they can not frown, if they cannot frown, this means that it is a lower motor neuron lesion. But if they can frown here, so it means it's a like this one is paired, so this would be upper motor neuron lesion. So now what is actually the mechanism, let's discuss it. So if the lesion is located in the motor cortex, connections from motor cortex to facial nucleus in pons. So here this blue one and this green one, see, this is the face area in the motor cortex. From here the nerves are going into the pons. This is the facial nucleus present in the pons. So the green one is making synapses over here, the blue one is making synapses over here. Okay, so now the second order neuron is going over here to the face, and here to the face. This one is on the forehead, and this one on the face. So if this is damaged, okay, so this one is damaged, so this is going to be affected. But if you can see over here that this one is not highlighted, which means that the opposite one is still supplying it. So the affected side would be contralateral. So if the lesion is present over here, the affected would be the opposite side. So if the lesion is present in the right side, then the left side would be affected. And muscles involved would be the lower muscles of facial expressions, and as I've said earlier, that the forehead would be spared, so the person can frown on the affected side. Okay, it's, and then due to bilateral upper motor neuron innervation that I've already discussed, so there is bilateral innervation, so the forehead would be spared. Other symptoms would be that it actually is going to depend on the size of the lesion. Okay, then lower motor neuron lesion. So the lesion is located in the facial nucleus or anywhere along the cranial nerve 7, which is a facial nerve. So if the lesion is over here, then there is the upper division and there is a lower division over here. This is a facial nucleus basically. So if we have an upper division, the neuron coming over from here is going to supply the forehead, and the neuron coming from here is going to supply the facial expressions areas. So this is going to be affected. So as basically these are affected because both of them are affected, so the person forehead and the facial expression both would be affected, and it would be on the same side, ipsilateral. So if it's on the same side, it is ipsilateral. Muscles involved would be upper and lower muscles of the facial expressions. Forehead involvement would be there, and other symptoms would be incomplete eye closure, dry eyes, corneal ulceration, hyperacusis, loss of taste sensation to the anterior tongue, as the cranial nerve 7 is actually involved in the anterior two-third for the taste, the chorda tympani basically. So this was it. I hope you guys have understood, and if you have, then do subscribe, like and comment. Jazakallah khair and Allah Hafiz.